Hello. Hi, everyone. Welcome to The Ordinary Doctor. I'm the Ordinary Doctor, Dr. Manan Mehta. And with me today is the extraordinary, the most in demand, and I think the most harried parent slash doctor of us all, Dr. Rupali Jain. Hi, Rupali. Welcome to the show.
Manan, I think already you have given a lovely introduction. So, just to repeat, I'm Dr. Rupali Jain. I'm a pediatrician and neonatologist. I have a private clinic, that's Rupali's Childcare Clinic at Vashi, Navi Mumbai. I'm also attached to corporates here nearby, like MGM Hospital, Vashi, and other corporates. So, hope to see you. If you need me, I'm always there available for you as a
Thank you
team.
so much. So let's get right into it. Let's speak about something which is in all the parents' mind. Every time a child gets fever or itches even a little, we are worried. Is it measles or not? What it means, for our parents today, as far as measles is concerned. So we know that measles is basically a paramyxovirus. All we need to know is that this is the same family of virus which has mumps, measles, as well as a lot of para-influenza viruses. So, Rupali, if you could just take us through the symptoms of measles for our parents, please.
Sure, Manan. I'll go through. So, first of all, I'm very happy that we are taking up measles because this is a very burning topic, I think, and every parent is scared about it with the news of not rumor, with the news of measles spreading all around Mumbai, especially Mumbai, Navi Mumbai, and Thane region. So, first of all, as a parent, you must be aware of the symptoms of measles. The first and the foremost is high grade fever that your child is going to have. Along with that, in the initial few days, the child will be tired or fatigued or malaise, what we call it, will have a lot of cough, coryza. Coryza is a cold congestion of the nose that the child is going to have. Along with it, the child will have a conjunctivitis or redness of the eyes. And that can be associated with watery discharge from the eye, which can lead to difficulty in vision in the sort of may not like bright light, that is called photophobia. So these symptoms usually develop around 8 to 14 days after exposure to measles, and they last for around 3 to 4 days, following which we go into the phase where we get the typical symptoms, the thing that we see in the photographs, the rash of measles. So the rash of measles, the Koplik spots that's mentioned in the slides that you can see, it's a white spot that is mentioned inside the mouth of the child, but usually it is not that commonly noticed in Indian children. So what we see is the typical maculopapular rash that we see. It to be to know it starts from the head or the hairline and then it progresses downward. It appears on the face, behind the ears, in the neck, and then down to the abdomen, chest, abdomen, and on the limbs, and then on the hands and the feet. So, a typical rash of measles is this red colored, a bit angry looking rash. It can be itchy and it usually lasts for around 7 days. It can start fading around 5 days, but 7 days is the average that we take that the rash lasts. So the photographs in the PPT you can clearly see how the rash is. It's a typical red angry looking rash starting from the face and progressing downwards.
So these rashes, are they typically itchy or they aren't that itchy compared to, say, chicken pox or something like that?
So compared to chickenpox, they are less itchy and they are less, less pustular. Like they won't have pustule or pus inside it. They are typically reddish and not whitish, but they can be itchy in some children and they can be very, not very comfortable for the child if they are itchy. So that's what when we have here with the chickenpox rash, you need to know that it starts from the chest and then it spreads to the rest of the body, like from center to the periphery. But the measles rash spreads from the head to the toe. And the other thing I told you, the chickenpox rash, it has those whitish lesions on it that you feel like it's pus filled, and the measles rash is typically reddish. It doesn't go into that whitish phase.
And the spread, now we are all worried, like, should we send our children to
Correct,
school or
correct.
not? And how does it spread?
So, to know, it usually spreads via droplet infection. So anyone who coughs, anyone having the virus in their respiratory tract, or they cough or sneeze, the droplets are there in the environment, and then your kid can pick up these droplets and hence get the infection. To be true, it is very easy to get a measles infection because the person is, infective like 3 days before the onset of rash, while there is a fever and everything going on, and is also infective 4 to 5 days after the onset of rash. So around a week or so, a child is infected. So it is well suggested that if your child is suffering from high grade fever, you may not send the child outside because he may be an infective source of measles. And the measles is usually it is 90% contagious. Like 90% of the people who get exposed to it, you can get measles. So it is better that if you have any symptoms, you are restricted to your own home and not venturing out. And if there is any other child whom you know in your school, in your kid's school that is suffering, you may not want to send the child to the school and also want to isolate that other kid as well.
Right. So can you now tell us about the complications of measles, please?
So this is because there's a lot of scare with the measles. So to be true, it is like a viral exanthematous lesion where you have the fever, then the rash, and then it goes away. For majority of the children, it goes in the same pattern. But yes, it has a tendency of going into more complications. So the most common complication that we have is what is otitis media or ear infection. And but the most debilitating and scarily, I would say, complication is pneumonia. So, because the measles pneumonia is the one which is causing the death, which you must have heard in the news channel that the first children are dying because of measles. It's basically because of the complication of pneumonia that the children are dying. Then the other rare complications, it could be like, early brain encephalitis, like a brain infection. There can be, the child can also suffer from diarrhea. There can be some eye disorders that can be mentioned. But I think otitis media, ear infection, and pneumonia is what we are really scared of, especially the pneumonia part.
So, what would you say that, what would be the right line of management for this pneumonia? We'll come to measles as a whole, but so the pneumonia seems to be the most common cause of deaths of late.
Correct. The pneumonia is the most common cause of death because of measles. So usually, since as we know, measles is a viral infection, we do not treat measles with antibiotics. It's usually a symptomatic treatment that we give. Treat the symptoms of fever, cough, coryza, and cough syrups, local application just so that there is less itching and the child is less irritable. If we notice any symptom of pneumonia in the child, sometimes like rapid breathing, the baby is breathing fast, the baby is not eating that well, the baby is having some difficulty, you can know, like the nose are flaring up while breathing, or the child is breathing very hard, that is when you need to urgently get your get your child a medical attention and may need an hospitalization for the same, and the rest of the treatment would be in the hospital, because depending upon whether there is oxygen requirement or not, what is the clinical condition of the child, the treatment would vary.
Right. So, in general, what would be the treatment of the child? Now, let's talk about the garden variety measles, which you and I have seen for so many years. What
Correct,
is the
correct.
typical treatment for that?
So typically, as I mentioned, it's the viral infection. So we go for symptomatic treatment. We give paracetamol for fever for management. We can give local application calamine and other lotion so that there is less itching on the rash. Then for the cough, your cough and cold medicines, your pediatrician would prescribe for the same. Other than that, no specific treatment is required. But yes, one thing I would like to mention here is what we do is a vitamin A supplementation in kids suffering from measles.
Okay.
Okay, so this vitamin A is very essential because measles lowers the level of serum vitamin A or retinol levels. So whenever there's any child coming with measles, we supplement the child with vitamin A. So the dose of vitamin A will depend upon the age of your child. If the child is less than 6 months, 6 months to 12 months, or more than 12 months. And it would require 3 doses, dose 0, dose 1, and then dose 14, like after 2 weeks.
Okay.
So the vitamin C supplementation is very important with measles infection.
So the vitamin A supplementation will be on day 0, day 1, and then day 14.
And day 14. Correct.
Okay, okay. And what about vaccination? So where would you place vaccination in this? So I'm sorry, it's a very vague question. Let me break it down better. First, my child is less than 7 months, not received MMR, seems to be asymptomatic right now. Should I vaccinate them immediately or wait for their turn?
So with the usually we give the MMR, that is the measles, mumps, rubella vaccine at 9 months of age. But with the outbreak of measles, it can be given as early as 6 months, not below 6 months of age. So in the clinical condition that we are discussing, where the child is around 7 months old, has obviously not received the routine vaccination at 9 months, can be given a dose of measles vaccine. The government campaign is giving a MR or a measles rubella vaccine, which the parent should go and take. And other than that, the child should, but this dose, the parent has to remember that this dose has to be considered as a zero dose. And the routine measles vaccination that I mentioned is at 9 months, the MMR, then at 15 to 18 months, and then at 4.5 to 5 years. These routine three doses have to be taken. Please do not consider this as a compensatory for the routine doses. This would be an extra dose.
Correct. ये एक bonus है. So all the parents,
Yeah.
if you are getting your child vaccinated before the 9 month age, you give them the shot right now, but do continue the usual schedule thereafter also. Now the flip side, my child is above 9 months, has received MMR one dose already. Do you think we should go for the booster right away or just wait and watch till their next follow-up doses?
Supposedly the child is an year old, the child should again still receive a booster of MR dose
Okay.
given by the government. The
Okay.
child should receive. Again, consider this dose as an extra dose and not in the routine vaccination.
Right. Now, third scenario. Now, this is a little
Yeah.
likely now, which is what is mostly happening. My kid has already got fever. The kid has already got fever. So, in this situation, I'm giving symptomatic care. Should we go and give them a booster dose in this situation or not?
So, in this situation, we are not giving the vaccine currently. We are
Okay.
waiting and watching for the symptoms. And depending upon, because a fever can be because of 100 different causes.
Correct.
So we need to wait and
Absolutely.
watch whether the fever is because of any other infection or it's actually measles. So every fever is not measles currently. Please don't be scared that every fever is measles. So wait and watch whether your child is actually having measles or any other infection which is causing measles. Get the child evaluated. And if it is due to any other cause, then let the child recover from the illness and then go for the MR booster dose.
Correct. So to summarize, if your child is asymptomatic, go and get that booster dose, but follow the usual routine if you can. If your child is symptomatic, hold on. Giving a vaccine won't work because she already explained the incubation period is 7 to 10, 7 to 14 days. So the virus is already there, might not help us. So how would you tell us that now, what can we tell our children in terms of prevention? Do we have anything which we can do to prevent the spread?
Yeah, so vaccination is the first thing. Every child in and around you, make sure that everyone has received their routine vaccination so that there's a herd immunity around you. No one around the child is getting infected. Second thing, as we have already everyone seen in COVID, that hand hygiene, since it's a droplet infection, it spreads through the droplets. Everyone coughing, sneezing. So the respiratory hygiene protocols and the hand hygiene protocols, which we have been, I think everyone is now well versed with, will really help in prevention of measles as well. But on the other hand, if I say it's very difficult to have these hygiene protocols with kids, to teach them to ask them every time to maintain that hygiene, it may be a bit difficult, but that's the thing that we can do. Another
Sure.
important point I would like to mention is maintain good nutritional status of your child. If the child is healthy, like the child has a good immunity, has a good balanced diet, good amounts of vitamins, minerals, and proteins, carbs, and fats in the diet, the child will be automatically have a higher immunity and be protected against many other diseases as well, other than just measles.
All right. And last question. Does getting measles once genuinely render lifelong immunity?
Yes, theoretically, yes. Even the vaccines are very protective. They are live vaccines, and after vaccination, it is said that you will not get measles. But to be true, we are seeing few cases in post-vaccination kids as well. But you can be rest reassured that if you have vaccinated your kids well, the disease intensity is much less and the chances of going into complications is much less.
All right. Thank you so much for a fantastic eye opener. And I'm sure the parents would really appreciate you taking time out for us today. Thank you so much, Rupali. Wish you all the best and
Thank you so much.
hope to have you on the
Thank you,
show
Manoj,
back
for
soon.
having me. Sure. Thank you.